Good morning. Welcome to our virtual town hall to discuss a stepped reentry into normal campus operations. I'm John Lehman, and I'll be moderating our conversation today. Some of the things that we're going to be talking about over the course of today and the next couple weeks and over the course of the summer will be the protocols that we have in place to make sure that our community remains healthy and safe. And some of those conversations will involve the modeling that we have in place to ensure that everyone remains healthy and safe. And I want you to know that our group here this morning is modeling the same things. As we came to campus this morning, we wore our face masks, and until we got into a place where we were 6 feet away from each other, as we are now. We'll be going into a lot of those protocols and regulations as we walk through the steps that are in place over the course of the summer. A couple of housekeeping items before we get going. We asked for some questions before the session over the weekend. We have those questions. After we get through our presentations, we will review those questions. You'll also have the opportunity to ask questions real time, and I'd ask you to use the Q&A feature that's on the Zoom interface. We're also recording this session so that you'd be able to go back and look at it later. We'll be sending out an email tomorrow regarding that and give you instructions on how to access that. We're also going to be reviewing all of the questions, even the ones that we might not have an opportunity to get to today, and so that we can review that and understand best what the community needs to understand as we move forward in this very complicated times. I'd like to introduce the people that we have here today around the table. First is Sarah Schulte. She's our General Counsel and Secretary of the Board of Trustees. She's been leading our MTU Flex Task Force. Joel Isaacson is our Senior Associate Athletic Director, and he serves when needed as our Director of the Emergency Operations Center. And we have Chief Cadwell. He's been leading the Health and Safety Task Force as part of Sarah's team. And of course, we have President Koubek. President Koubek is going to open us up this morning with a few comments.
Sure, thanks, John.
Rick?
Thank you. Before I start, I wanted to say a word of thanks on behalf of Michigan Tech. First of all, to our essential workers who have been coming to campus during this time and providing the services for our students while they were here, and then to keep the campus operations going. I also want to thank the faculty. It was during spring break Wednesday afternoon that we announced that we were going to, within a week, switch over to online classes, and you did an extraordinary job protecting the integrity of the institution the way you did that. Likewise, the staff who are trying to keep the university running from working at home and doing everything through Zoom meetings. We know that's non-trivial, but you've been doing an excellent job. To the students, we know this is what's unusual, having to pack up and leave and get your courses through online. But thank you for bearing with us, and know that we miss you here on campus. Also, a note to the University Senate. As you know, we've had to do some quick actions and pass some regulations and rules to be able to adapt to the situation. The University Senate has been there. And also a note of thanks to your willingness to participate over the summer as we try to deal with the evolving crisis. I do also want to say a quick note on behalf of the campus, thanking those that have done the extra mile to help the community. For example, Dr. Height and the COVID testing lab, setting that up within a week and providing a testing facility right here in the UP, right here on Michigan Tech's campus, has been invaluable for the plans that we're going to talk about today. To that team, that has been a game changer. Joshua Pierce and his team with 3D printing and making medical device through 3D printing to be able to help provide supplies for our hospitals. Again, game changer for our community. Andrew Bernard and his decontamination unit trying to find ways to extend the life of the PPDs so that we can continue to provide our healthcare workers with the N95 masks that they need. So not only did the Michigan Tech faculty and staff step up to the plate to protect the integrity of the Michigan Tech experience, but you went beyond that to be sure that we reach out and support the community. So on behalf of all of us, I wanted to thank you for that. But be there no mistake, the transition so quickly has been hard. And we can just admit that. It's been a challenge, and as you would expect, Michigan Tech faculty and staff and students have done the extraordinary. And sometimes it's oversaid that the extraordinary is the ordinary at Michigan Tech, but it's a true statement. It's a true statement. The word unprecedented is used quite a bit during these days, but I would indicate to you that that's an appropriate word. What we're facing has been unprecedented. And while it's hard, you've all stepped up to the plate. And I would like to tell you that we're nearing the end and it's over, but it's not. We've dealt with the transition to being online and to being away from campus right now. We have 2 more hurdles that we're going to have to face. Know what that, while it's not over yet, it will be. We have, just like the rest of the nation, the rest of the globe actually, we have 2 sides that we have to deal with now. One is going to be the fiscal implications associated with this pandemic, and the other is going to be how do you reopen in a safe manner. We're not going to talk about the fiscal implications of the budget piece today, but you saw the memo that I had sent out that we are preparing for a new budget that would be presented to the board that deals with an expected deficit of $18 million. The budget that's under development now will be austere, but we'll manage through that as well. There'll be more information to come on that as it develops, but we won't be talking about that today. Rather, we're talking about the part that we really can control, the part that you can control, and that's the reopening of the campus. You need to know that this was a decision that we made based on the experiences as we rolled the campus down to a shutdown mode and what's been happening now. And that is, we have great confidence in the faculty and the staff and the students at Michigan Tech to be able to do this in a safe and effective manner. You're going to hear some details today, but I can confirm to you that there's much more details in the full document. It's probably over 100 pages, and when you hear today, you'll just hear the top of that. But there's a lot of work that's been going on, and now we're ready to start putting forward the implementation. That's why I have done a partial activation of the Emergency Operations Center and asked Joel Isaacson, as the director of the EOC, to step forward and help us manage, working with the team that you'll hear from Sarah Schulte in a minute, to put that forward. Now, no, we won't. There was lots of uncertainty still, and that's okay. That's what you would expect in this time. We know that it's going to require compliance in ways that we're not used to, but it's also going to require creativity on your part to be able to comply and still protect the integrity of our institution. But we have to succeed with this effort on reopening in a safe and effective manner, provided that the government allows us to do so. And we're going to count on each of you to help us make that so. So with that, John, thank you for the opportunity to make some opening comments.
Thanks, Rick. Before we start talking about the future, we thought that it might be helpful to give some context regarding what we've done to date. And we're going to ask Chief Cadwell to review a little bit about what's been done to date and what we're seeing on campus right now. Chief?
Thank you, John. Overall, our community has done an excellent job in complying with the governor's stay home, stay safe guidance. To those who are on campus, have practiced good hygiene and social distancing, I want to say thank you for your efforts to help keep us safe at these early stages. It's important for us all to continue to take these precautions so we can safely and gradually move back toward normal operations. During this time, Public Safety and Police Services has focused heavily on facility security to make sure our properties are protected and safe, and ensuring that any building infrastructure problems are encountered are reported to maintenance promptly so they can be corrected. We've taken on a variety of tasks to enable those working from home be able to continue to do so. It's been a mixed bag of anyone from helping IT to helping take back items from different areas on campus. We've conducted security for the drive-up testing facility to help ensure that there are no violations of the HIPAA laws. And we're working to provide PPE to those who are working on campus to make sure that they're safe in the current situation. As for PPE, we're working with Environmental Health and Safety and others to maintain sufficient inventories of various types of PPE to those working on campus to have proper protection for their specific job duties. This is going to be an ongoing effort into the foreseeable future, which we are still continuing to work with. Anybody with particular questions or concerns is asked to contact Public Safety and Police Services at 487-2216. We are on duty 24 hours a day, 7 days a week, and if we have a concern brought to us, we can either resolve it directly or else direct you to the proper person or unit to help you with your problem. Thank you, John.
Great. Thanks, Brian. We've asked Sarah Schulte to give us a run-through of the steps that are currently being proposed. She's got the heaviest lift this morning, so we'll turn it over to Sarah and let her walk through her presentation.
Thanks, John. There are many people across campus who've been diligently planning for the return of faculty, staff, and students in a safe and responsible manner. We've developed a 3-step plan that's designed to maximize our opportunity to return to face-to-face instruction in the fall. There are many variables, many unknowns. So much of our planning right now is contingency planning, ensuring that we're prepared to quickly pivot and move to alternative solutions when we need to do so. We don't know what state orders will be in effect in June, July, August, September. We do not know what the prevalence of the virus will be in our area, statewide, or in our nation come late summer and fall. We don't yet know what the availability of viral testing and the availability and accuracy of antibody testing will be at those times. All of these variables and many more mean that this is not a simple and straightforward plan. It's important for you to know that we are working to actively track and monitor all of these variables and put appropriate plans in place. Tech is a STEM institution. We're diligently working to make sure the decisions and the plans we're making are scientifically based and scientifically informed. The research on the virus is rapidly developing. We're working to stay abreast of that research and implement it in a way that makes sense in our community. In recognition of the flexibility that's required to do the planning related to COVID-19 and safely returning to campus, we're calling the team working on this solution the MTU Flex Task Force. The task force is divided into 6 working groups. The academic and research group is led by Jackie Huntoon with significant work by Dave Reed. Student life is led by Bonnie Gorman. The health, safety, and medical group is led by Brian Cadwell, who's here with us today. Facilities and dining is led by Teresa Coleman-Kaiser. Our HR and finance group is led by Sue Carey, and our communications team, of course, is led by John Lehman. Joel Isaacson, the director of the EEOC, has been stood up to project manage this and from an operational perspective, bring the plan into action, and I am chairing the group. Our return to campus planning is predicated on 2 important values. Those are personal responsibility and a respect for individual choice. We know that there is a desire to have all of the details finalized and know exactly what is going to happen and when it is going to happen. We cannot give you that at this point because of the number of unknowns, but what we can give you is a sense of where we think we're headed and what we're thinking about, what we're keeping track of and monitoring. Step 1 of our plan, and I'm going to put an important caveat on this here because you'll see some dates throughout this document. These are our best guesses at this point as to when we'll be able to take these steps, but these, like everything else in the plans, are influenced by a number of variables. So I'll tell you, step 1 will begin as soon as the state's stay-home order lifts and we are allowed to take this step. It may or may not be around May 28th, but as soon as we can do this step, we will. We'll have very limited campus operations returning in step 1. This will allow us to test our new systems that we've put in place that are designed to safeguard our campus community and those who are most vulnerable. We'll see a limited return of employees, and remote work will remain mandatory except when employees are scheduled to be on campus by their supervisor or by their chair or their dean. We will have daily symptom monitoring for those coming to campus. We will have testing for individuals who are symptomatic. I'll talk a few times about the testing program that we'll be implementing here at Tech. I want you to know that the testing program will be voluntary, but for individuals who are symptomatic with symptoms indicating COVID-19 and choose not to be tested, we will be asking them to stay away from campus for at least 14 days, consistent with the CDC guidance that is in place at the time those decisions are made. We will have stricter sanitation and hygiene requirements. We'll have enhanced cleaning protocols. Our common areas, our lounges and break rooms will remain closed in step 1. We will require 6-foot distancing, and face coverings will be required both indoors and outdoors when that distancing cannot be maintained. We will have no more than 10 people in shared spaces at a time. And critical travel will only be approved on a case-by-case basis at the vice president level. We expect that computer labs will remain closed. We also expect that the library will remain closed to visitors with some remote operations functioning as they are now. We don't expect food service or transportation services to be operating during phase 1. We think that the golf course and tech trails will be operating as they are now in accordance with the applicable state guidance. Step 1 will see research labs begin to reopen with strict social distancing and hygiene requirements in place. We do not expect to be hosting events on campus during this step, and we also expect that the Rosé will remain closed. In step 2, my slides seem to be stuck. But in step 2, you'll see additional, but not all employees return to campus. You'll see the library slowly reopening, and some retail services will begin to open. We will implement what we learned in step 1 and continue to work to protect those in our community who are most vulnerable. Remote work will remain encouraged when and where it is effective, and particularly for those who are in our vulnerable populations or those who are caring for at-risk individuals. Daily symptom monitoring will continue, and if permitted by health guidance and supply chains, we expect to roll out our testing to include some asymptomatic individuals at this point. We will launch a public awareness campaign to introduce new social engagement expectations and hygiene protocols. We will have no more than 25 individuals in a shared space at this time. As we bring back additional employees, those working in cubicles and other shared environments will likely be asked by their supervisor to stagger their on-campus and remote schedules to limit the number of employees in a shared space at one time. Computer labs may begin to reopen, and the library may begin to reopen to visitors with limited services, occupancy, and hours. The SDC will follow applicable guidelines from the state regarding reopening, but will begin to reopen if permitted. And structured campus tours and prospective student visits may begin to resume at this point, with required symptom monitoring and limiting group sizes. In step 3, we will see the return of most employees to campus and return of students to campus. Remote work will remain encouraged for those vulnerable populations. Our residence halls will be open, although certainly you will see adjustments in how they function. Our dining services will reopen, and you'll see expanded grab-and-go services across campus. Those working in cubicle areas are expected to be allowed to resume their normal work hours at this point with appropriate PPE, hygiene and sanitation protocols, and cleaning protocols in place. We expect to see the flex start to classes at this point. While we don't know yet exactly what that will look like, the academic group is working to diligently plan for many different possibilities. In all likelihood, many of the courses will be offered in a combination of remote and in-person instruction. We anticipate at this step that no more than 50 people will be likely permitted in a shared space, that transportation services will reopen, and that the Rosé may be able to reopen within the limits set by the state. Most important as we return to campus will be every individual who comes to campus honestly and faithfully doing their daily symptom monitoring, practicing enhanced hygiene, which is washing our hands frequently, not touching our faces, and wearing face coverings in situations where we cannot maintain 6-foot social distancing. Staying away from campus when we feel unwell. We are working hard to have a sophisticated testing system in place prior to the return of students. Our epidemiologist on faculty, Kelly Cam, is leading our contact tracing efforts. And our residence life group is working closely with the Western UP Health Department on establishing appropriate isolation protocols for those students living on campus. We're operating under the assumption that we will have cases on campus, so that we are prepared to contain and monitor when that should occur. But we are also working diligently to prevent that occurring in the first place. Everyone working together towards these goals is what will allow us to come together safely again. And now I'm going to turn this over to Joel Isaacson, who's going to talk a little bit about his role in putting the plan into place.
Thank you, Sarah. Recently, President Koubek has activated me as the project manager for the MTU Flex Task Force. I will be focusing on implementing the return to campus plan that Sarah has just outlined here today. I'd just like to take a moment to introduce my background. I've been fortunate to be part of the Michigan Tech family for over 20 years, working in athletics and recreation. Our team manages large-scale events and handles project management daily. When activated by the President's office, my focus changes into one of the directors for the Emergency Operations Center, most notably during the Father's Day flood. At this time, the rest of the EOC will remain in a standby mode, and I will be the only one that will be activated. Thank you.
Thanks, Joel. Thanks, Sarah. We're going to start with a number of the questions that were provided over email the last couple of days. Sarah, first one would be good for you. When students come back to campus, if the COVID-19 situation is not much better, will we ask students, especially those from the hot areas, to come to campus 2 weeks earlier and stay isolated to the best degree possible for those 2 weeks?
So how we return students to campus is something that is actively being worked on by the Student Life Working Group of the Flex Task Force. They are working with the Western UP Health Department and the remainder of the task force to come up with a plan that makes the most sense based on accurate scientific evidence. Right now, we are thinking, although it has certainly been discussed, that isolation up here for 2 weeks is probably not practical given the mix of on and off campus students, lease terms, the behaviors of college students, and other variables. However, the current thought is that our solution will include enhanced testing, potentially focusing on those areas where the virus is prevalent at that time, increased symptom tracking, contact tracing, and isolation protocols that we are ready to put in place as soon as we return students to campus.
Great, thanks. Joel, this one might be good for you. This person wrote, "It will not be possible to clean and sanitize classrooms between classes. Moreover, most doors on campus are not automatic and many have double entryways with 2 doors. What plans are in place to keep those in other areas sanitized?"
Thanks, John. That's a great question. Our facilities team is working to minimize the number of touch points that you're going to see on campus. They're also looking to inventory the hand sanitizer stations and increase those as necessary to meet the demands of campus. Our custodial team is adjusting their cleaning protocols and aligning with best practices, including more frequent cleaning of those high-touch surfaces that were mentioned. In addition, our academic and facilities teams are also working together to plan out how fall classes will be handled, the cleaning in between those. There's so many variables, and those plans we're still working through those. We're even looking at providing wipes for faculty, staff, and students to clean their area as we go through. So additional information will come out in future on this.
Joel, let's stay with that subject for just a bit. This person wrote, "I'm a front desk person who greets everyone entering the office. What protocols are being put into place to adhere to social distancing, the requirement of face masks, hand sanitizers?" I would imagine this person might be thinking that they're going to be asked to enforce those sorts of protocols.
For sure, John. So customer service at Michigan Tech is key moving forward, and it's going to be an important checkpoint that we're going to want to maintain, that those individuals are safe. Face coverings will be available. Either they'll be provided to you, or if you're more comfortable with your own, you're welcome to bring those. Cleaning supplies, I mentioned wipes earlier in my previous answer. Those will be provided to help with those high touch points again. And then depending on where you work and the number of visitors that you're looking at, you can work with your supervisor on other safety measures to maintain your health.
Thanks. Sarah, I know that the last couple of weeks as we've walked into grocery stores or whatnot, we've seen plexiglass up to put a barrier in between the customers and those that are working in there. This person asked whether there might be plexiglass shields in the classroom to protect faculty.
It's a good question. So our academic working group and our facilities working groups have been working on what those best solutions are for protecting faculty in the classrooms. I would say it's unlikely that we will have a one-size-fits-all solution to this. What we will be doing and what we are doing is trying to figure out what solutions make place both in different classrooms and for different faculty with various concerns. So plexiglass is one option that's being discussed. There are also other options that are being discussed, and we're going to have a much more robust answer to that in the coming months as that academic group really works through that issue and comes up with a more final response to that question.
Good. Rick, this question speaks to, I think, a recognition that there might be various risk tolerances amongst different populations, and this person asked whether faculty will be permitted to make the decision themselves regarding whether they teach in person or online. Could you speak to that?
Sure. So it is a university-wide decision as to whether we bring students back in the fall, and assuming the governor allows that, we've made that decision. Within that context, though, there are working groups such as the academic working group that are looking at the flex plan to be sure that if you and when you do go into the classroom as a faculty member, you feel safe in that regard. So that would be something that they're working on right now. And again, the principle here is to be sure you feel safe and comfortable when you're in the classroom.
Sarah, when we talk about vulnerable populations, how do we define those?
We are following the CDC definitions of the individuals who are at heightened risk of contracting or heightened risk of complications from the coronavirus. So that may change between now and fall. We've seen it shift a couple times, but we are going to continue tracking that CDC definition even if it does change between now and then.
What if we have an outbreak on campus? Sarah, what plans are in place there?
This is something we've been talking about a lot. So we are working very diligently to make sure that if cases appear on campus, that we have all of the pieces of the puzzle in place to contain that quickly. So right now that includes our daily symptom tracker app that we're developing and will be pushing out, also our testing protocols. In addition, when we do have cases emerge, we're working very closely with the Western UP Health Department to make sure that we have contact tracing in place that allows us to track down those contacts very rapidly, notify people that they may have been exposed to the virus, and have those isolation protocols kick in to make sure that we are able to minimize the spread and get that under control quickly. We consider that a very important part of being prepared to bring our students back for the fall.
We got a question asking whether your team has looked into the healthcare capacity in our area.
This is something we've been actively monitoring. So the Michigan Economic Recovery Council, some of you may have seen this, had come out with kind of a group of slides that talked about what the state would be looking at as far as reopening, and some of that did relate to healthcare capacities, so we've been monitoring that pretty closely. Under healthcare capacity, that they broke it down into 3 categories. So they looked at hospital beds and ventilators and PPE. For hospital beds, what we have noticed is that the UP, which is one entire region in all of these reopening plans, actually has the 4th most capacity in the state. So, you know, of the 8 regions the state is broken down into, we're kind of right in the middle there and in a pretty comfortable position. We're also the 4th in the state for ventilators, and we're actually 3rd in the state for available PPE. So right now we seem to be in pretty good shape in those areas. We are going to continue monitoring that, but at this point, we're not seeing a risk of not having enough healthcare capacity at this point.
And again, that's normalized for the population of the UP, right?
Absolutely. It's normalized for the population of the UP.
Great. Brian, this is a good question for you. I know that you've been working with our PPE supplies on campus since this began. This person asked, when campus opens on phase 1, would the university be able to provide N95 masks and other safety items to people on campus?
Right, we've been working to build and maintain sufficient inventories of PPE and face coverings. Our planning aligns with CDC guidance on this issue. If you cannot maintain 6-foot separation from others, you need to wear a face covering whether indoors or outdoors. N95 masks are intended for use by individuals in high-risk situations where they may come in contact with somebody who is suspected to have or confirmed to have the COVID-19 virus. For common daily use for others, you may use your own face covering. A cloth bandana or other variety of face covering is sufficient. You've seen different varieties all over the news these days. We're in the process of building inventories of the various types of face coverings and PPE items to help ensure that all on campus are protected. And again, I want to remind anybody who does come to campus that you do need to wear a face covering unless you've got 6-foot separation from others.
Great. Along those lines, we've got a question that came in. Sarah, does MTU have enough COVID-19 tests kits?
So the test kits are not actually property of Michigan Tech. What we are running here at Michigan Tech is a COVID-19 testing lab. So we're processing tests that are taken from the local medical community. At this point, the test lab is not operating at full capacity, meaning we have more ability to run tests than we do have tests coming in from the medical community. There have historically been some supply chain slowdowns and other issues relating to the swabs. My understanding is that those are easing up at this point. So we'll see if we see those numbers ticking up, or if at this point there just isn't quite the demand for testing that there is for capacity here. But right now we're pretty comfortable from a capacity point to run those tests.
What about antibody testing?
So antibody testing, a lot of people are talking about this, and there are antibody tests out there. At this point, there's a lot of scientific concern about the accuracy of antibody testing, and we don't anticipate making it part of our solution until we can be more confident than we are right now on that reliability. We don't want to ask people to have a test if we can't be confident in the results that it gives us. But it's something we are continuing to monitor, and if there is an accurate antibody test out there come fall, we may well put it as part of our testing solution to maintaining our finger on the pulse of the health of the Michigan Tech community.
Had a number of different questions about what we're planning for students. So how will students self-isolate on campus?
So I think we're going to see a couple different answers here. The students who are living off campus, we do not have as much control over, and we recognize that's a significant number of our population, but we will be providing guidance to those students about when they should be self-isolating and what that self-isolation should look like. For those students who are in our residential living environments, we have a lot more influence and control over that. As I mentioned earlier, our residential life folks are working closely with the Western UP Health Department to determine what those isolation protocols should be, and we'll be in alignment with those come fall. There will be guidance regarding what that isolation should look like, and it's consistent to the guidance that you've seen out in the community about staying apart from others.
What if we have a student who tests positive? Where might they go?
Well, there's a lot of variables there. So our students go lots of places, as we know. If we have a student who tests positive, who's living within our residential living facilities, at this point that plan is not finalized. They will either be moved into a separate location, or depending on what the final plan is with the health department, it could be that we quarantine those students in place and have them remain in their room with their roommates until that time of risk has passed. That will be finalized before fall. If they're off campus, then what we will be asking them to do is to stay away from campus until the current CDC guidance at that time would permit them to come back to our campus community. And I expect we'll see that shift some between now and fall.
Let's switch gears a little bit. We've got some questions about labs and when they might reopen, and will they all open at once, or will there be some prioritization that goes in involvement with getting our labs back open and getting our researchers back in those?
So Dave Reed has been working very actively on the process for reopening research labs, and I think he has a communication coming out on this relatively soon if it hasn't gone out yet. So we are anticipating that we will begin to be able to reopen research facilities in step one. It will not be an all or nothing solution. It will be a phased process, and Dave Reed will be rolling out the details on how that plan will work.
Can you speak to a little bit about when faculty can get back into their offices if they need to grab some things in preparation for the fall?
Yeah. So a lot of this, there's so many variables. I feel like I can't ever give a straight answer right now, but I'll do my best. So if you need to get into your office to prepare you to enable you to do some remote teaching over the summer, we can grant a one-day exception for that now, and there's a link on the COVID-19 website for you to request that access. If you have time and you don't need anything right away, what we would ask is that you wait for the expiration of the stay-home order, hopefully at the end of the month. And at that time, we're going to be able to ease up the restrictions on letting people in for different periods of time, but within social distancing and other parameters to ensure we don't have too many people in a space at one time and we're doing it safely and smartly. And we'll be able to get you in to get the things that you need, and possibly at that point even be able to schedule some regular days on campus depending on what our guidelines look like.
Chief had a question whether we might be able to mail the face masks to folks before they step on campus.
We currently have no plans for that. I would say that probably the best way would be we would set up a location on campus where people can come to centrally to pick up the mask when they get to campus. We'll take it into consideration though. Okay. Thank you for the question.
Yep. Rick, if classes are going to be remote and students don't have access to things provided underneath the Experience Tech fee, will lab fees and the Experience Tech fee be removed until normal operation resumes?
Right, so as I mentioned to you before, we're developing the budget model now, and we're taking a look at how all of these flex situations would impact our budget to be sure that we can be fair and equitable to the students, just as we had previously done with regard to the housing refund. But in addition to that, we are looking at ways that we'll be able to help students that perhaps don't have the technology necessary if we do have to go online.
Okay, good. Sarah, there's a question asking whether the library might be permitted to offer curbside pickup of library books. Stop in and pick up books.
At some point, that could be a service that they are offering. I believe right now they're doing a phenomenal job in helping people. If you need access to materials, I would encourage you to send a message to the library. They are providing a lot of materials in different formats right now and really doing a great job and being a great resource to our Michigan Tech community. So please feel free to reach out to the library, and we'll see when we can get those services expanded. We'll do that.
There's a question about student employment, and I would imagine that we would perhaps see student employment underneath phase 3. Could you speak to a little bit about what we might be able to offer students when they return?
Yes, so when we do bring students back to campus in the fall, we would expect that there will be student employees on campus in the same manner that there always is. Our needs and demands of those student employees may shift, as are the needs and demands for many of us shifting under this current COVID-19 situation. But we will have student employment in the fall. We may start to see a few student employees coming back in step 2. I would expect that would be limited potentially to our RAs, our orientation leaders, and others who work directly with those students we're going to bring back in step 3.
We've got a mother who wrote in and said, currently my son is scheduled to be in a triple in McNair. What sort of conversations are going on about the capacity in the residence halls?
This is absolutely something we're talking about on a regular basis. We will have that plan rolling out hopefully relatively soon about where students will be living and what capacity we expect to be able to offer. I will say we don't yet know what the state guidelines will be regarding congregate living situations. We are planning for what we think is appropriate in our conversations with the health department and other medical providers across the area. And so we probably will be limiting the number of students in particular spaces, and we will have plans in place for what to do as far as isolation and positive test cases and increased testing within the residence halls, especially when they're returning to campus those first few weeks when they return here in the fall.
Sarah, you mentioned that we'll be asking people for their symptoms, perhaps on a daily basis. What if students are symptomatic? What sort of instructions might we give them and where they might go if they do experience those symptoms?
Yeah, so there's a couple different things that are a part of that. The first thing we want students to do if they have symptoms that are related to COVID-19, and this is another area where we are following CDC guidance on what those symptoms are at any given time. They shifted maybe a little over a week ago to include some additional symptoms. So we'll stay up to date with that. But the first thing we would ask them to do is stay away from campus and stay away from other students during that time. We want them to isolate until they figure out what's going on. So we would encourage them to reach out to a medical provider at that point. We have that information posted on our website and readily available for the local medical providers. And if they choose not to go to a medical provider and not figure out exactly what's going on in their particular situation. We are going to ask them to stay away from campus in accordance with CDC guidelines at the time, whether that be for 14 days or some different day variable depending on their symptoms and what's going on.
Okay, great. I know that we've got, Chief, I know that we've got drive-through testing service. Are there any plans to keep that in place? And might that be a place where students could get tested if indeed they are symptomatic?
I don't yet know don't yet know how long the plan for the drive-up testing is. Currently, it is ongoing. It will depend on numbers. We have seen a downturn in the number of people coming up for testing, and would encourage people to access the service through the 800 number that's been provided by the health department. Make an appointment, get tested.
Okay.
If they have any symptoms.
This question, I think, speaks to the complexity of the times that we're living in. They said, for faculty, staff, and students who are parents of school-aged children, what considerations might be given for remote work and childcare before school and daycare reopen? I know you're in the
I feel your pain. This is an excellent question. I think that, you know, remote work will remain strongly encouraged through the first couple steps in our plan. I don't think we yet have an answer. Heaven forbid, should schools not reopen in the fall. I don't think we've battled that question yet, but we will certainly get there if that looks like a probability. Yeah, as far as the summer goes, I understand. I'm working with 3 kids at home all the time, and it's a challenge. And you know that we have some solutions in place through HR, and you're welcome to reach out to them. There is the emergency FMLA that's available if you are not able to perform your job duties due to your need to provide child care during this time. Off the top of my head, I believe that provides for 12 weeks of leave. I think the first 10 days is unpaid, and it's at 2/3 salary after that point. But beyond that, that's something we're actively looking at and monitoring as this process goes forward.
What about students who might not feel safe coming up to Houghton? Will there be opportunities for them to take classes from where they currently reside in the fall?
So I think that this will potentially, again, not be a one-size-fits-all solution. For students who are members of a vulnerable population, so for students who have underlying health conditions or other reasons to be concerned, I would encourage them to reach out to Student Life to try to put some solutions in place right away that are going to make them feel more comfortable. There are things that are going to be available as accommodations for certain students. If we have other students who are feeling uncomfortable who don't fit in that category, I would likewise encourage you to reach out to Student Life so we can gather a sense of what that number of students is, and we can work on potential solutions. We want to keep our vulnerable population safe, but we also do want to bring our community back together, and that's going to be a balancing act. So we're going to do what we can to work with everyone in this particular situation, but at this point we don't have any final answers for people who are not members of a vulnerable population in that particular situation.
I know that we've changed the false academic calendar and to provide a couple of days mid-semester, and then of course we have the Thanksgiving break. And how are we planning to manage students going back home and then coming back to campus, knowing that they may be returning to hot spots and shaking the jar up all over again, as it were?
Yeah, so this is something that another thing that we're monitoring, looking at, evaluating, and preparing for on an ongoing basis. So a lot of what we will do in that particular situation depends on what the situation looks like at that point. Have we had cases on campus or not? Are there areas in the state or where students might be traveling to that have current cluster cases or not? Depending on those answers, the solution may be very different. We may be in a situation where we ask students to remain in the area, and for those who choose to travel, we ask them to remain away from campus for 14 days upon return. It's likely that when students come back from any sort of break, we're going to have some increased testing in those time periods to make sure that we do have a handle on what's going on with our campus community from the perspective of whether or not the virus is present. But that is something we're working on and planning for, and as we get closer to those dates, we will get messages out with answers to those questions.
I know that I've been involved in a number of different conversations regarding summer field work. and research. And Dr. Hunton has been speaking with us about that. Could you speak to a little bit about what we have in place for that?
So that conversation regarding summer field work is ongoing. Dave Reed and Provost Huntoon have been active parts of that conversation. Where it is allowed by the state orders and guidance, we are trying to make some room for some of that research to go forward if limited numbers and social distancing can permit it to go forward. There are some field research instances where people are essentially out on their own in the woods, and that's something where we're finding we're able to accommodate. Bigger groups gathering together is not something we're able to accommodate at this point, but we are actively monitoring what the state is doing with guidance to try to figure out what the right solution is for each of those individual courses.
Okay, great. Joel, I know that your team, you're working with the team to help operationalize this, and we've spoken a little bit about continued communication over the course of the summer. Any thoughts about that and how others might find out what the plans look like as we move forward?
We'll be utilizing the MTU Flex website moving forward, transitioning from the MTU COVID site that we're currently using. So during that transition time, we're gonna point people to that MTU Flex site for their information, and then send out campus information as we can or need to.
Okay, great. And to that end, I think we'll wrap it up at this point. We will be having this recorded, and we'll be posting this on the website. We'll have a follow-up email that comes out tomorrow speaking to each of these things. And we look forward to continued communication, as this is a very fluid situation, and we understand that communicating in a manner of transparency and clarity is utmost important to make sure that we're able to fulfill our mission as an educational institution while making sure that our community remains safe and healthy. I thank you very much for joining us this morning for this, and we hope that it's been useful to you. We thank our panelists for their time this morning. Thank you very much.